Hi everyone, this is Neel Raithatha, consultant audiologist and director of earwax. Thank you for joining me in my latest video using the iClearScope endoscope. If you follow me on Facebook and Instagram, you would have seen that I uploaded a still image of a plug of wax that looks like a cocoon. And this is the video to that image that I shared earlier today online. Now, this is their right ear. The plug actually came out of their left ear, and they've got extremely hairy ear canal entrances, as you can see, and also very narrow bendy ear canals. And in fact, in this procedure, I'm actually asking the patient to pull their ear back. And typically, when we treat this patient, they come twice a year. They normally attend with a lot of inflammation of the entrance of the ear canal and a lot of edema. And the problem there is that when we then insert the suction probe, the canal collapses, so it closes upon itself. So just to avoid that, although their ear wasn't as inflamed and there was not much edema swelling at the entrance, I just wanted to make sure the ear canal doesn't collapse as we enter with the microsuction tip. For that reason, I actually initially used a 16 gauge suction probe, but because the ear canal wasn't collapsing, partly because the patient was pulling their ear back for me to just dilate it, I then went to the 14 gauge, the normal suction probe that we use. It's very seldom that I ask a patient to pull their ear back. Probably one of two patients that I can recollect that I asked them to do, but it's just much more comfortable for the patient. And normally with this patient, I use the metal instruments because their wax is extremely hard, and even with the right instruments, which are extremely powerful and strong, the stainless steel one just works better with this patient. But in their left ear, I use a combination of the rye correct and also a metal Jobson horn. So we've cleaned this ear. I'm just mopping up around the edge, just a bit of dead skin here. Now the optics, because of all this hair, I mean, for me doing the procedure, it wasn't problematic, but I can understand as a viewer, it may not be the best quality image, but this is what we have to deal with in clinic. Sometimes you have patients with these ears. We can't pick and choose, unfortunately. I have previously tried to trim the hairs, but it wasn't really effective. And as I said, when doing the procedure, it's not really hampering me that much. So, and because of all the hairs and because of the skin, you see there's a lot of reflection, a lot of glare. So, I'm just trying to peel some of this skin. This is the healthiest I've seen this patient's ear in a few years, actually. So they do suffer from chronic otitis externa, which results in an accumulation of dead skin. And they do also get water in the ear, and the patient is aware that the water is a trigger, but they find it difficult to avoid, particularly when they go swimming. They've tried plugs before, even custom molds, swim plugs, but they don't fit very well, and the water still enters. So it's just a bit of mushy dead skin lining the anterior canal wall. This is the cartilage portion, so we can apply a bit more pressure now. We're moving on to the left ear. So it's normally their right ear that's the problematic ear. And even today when they're tending, they felt their right ear was the worst. But this was the ear that I removed that plug. And it, again, got a very narrow entrance, and a lot of hairs. Now these hairs, not only are there a lot of hairs, but they're long. So they're almost crossing over from the canal, from one side of the canal to the other, almost bridging over. The entrance of this patient's ear canal was extremely dry and flaky as well, so the otitis externa is a bit more present in this ear. And it's normally just the outer cartilage portion, the inner 2/3, the bony portion is normally quite healthy. And so once again, I've just got the patient to pull the ear back. And this plug was solid, it was lodged. And you'll see when I remove the plug, they've got a very inclined ear canal. Our ear canals as adults, when you enter, they do have an upwards incline, on average around 32 degrees, but obviously that's going to vary from patient to patient. So I'm just using the right angled ear hook. I managed to get in and behind, and I was hopeful this would come out, but it just cut through, which is a bit disappointing because I did the hard work getting it over and beyond the wax plug, particularly because it's such a hairy ear. It's a bit more challenging, but managed to do that, and you can see that cut right in the middle, so it's dissected it. So I've just put some drops in. Now the consistency, it's rock solid. The main plug is rock solid, but the lateral aspect, so the surface of it's got this clay consistency, which is probably one of the worst. Now, in terms of suction doesn't work really well. The correct and the hook just dices through it. So I'm just trying to lift this off the canal wall, and there's a bit of drops there. So it's, the view, as I said, I do apologise, but this is because I know there's going to be a few comments in relation to it. So I thought I'll address it. Although I don't think that'll make much difference. So I'm just trying to wriggle this. It is coming loose. Again, I'm just using the ear hook, and I'm trying to go posteriorly. I'm angling it slightly differently, and I want to then rotate it so the tip goes to the middle. And again, it just kind of cuts through it because of the consistency. So to remove this, we're going to have to go over and beyond the wax. There's no other way, and suction is not going to remove this unless we really dose the ear for a while. And I think I'll probably use a bit more drops in a moment to see if we can. So I've got the hook through, but it's just cutting through. So it's the Jobson horn we need, and we want to get it above and beyond. And with the Jobson horn, you have more surface area. So this is the metal one. So this is, I initially used the metal, but even with the metal one, it's so impacted, it's so compressed against the posterior canal wall that it's really difficult to move. And with the metal one, it's chubbier. So with the Rycaret, it can glide in a lot better. So I've managed to get a subsection out here. I think I'm going to use the metal one again, but I'm going to then use the Rycaret, and I'm going to be able to go over the top of this. I'm able to glide it, and I do manage to create a bigger space for me then to use the metal version. So I'm just going back on the suction just to see if we can just wriggle this and just create a bit of space. So although I'm at this stage, I know that it's not really going to come out with suction, but if I can just wriggle it a little bit and just create a bit of an opening at the top. So I'm just going up and down, and I think I've just managed to create a bit of more of an opening, which we'll see. So this is the Rycaret. You can see it's much easier to glide over the top because it's got a tapered tip. And I'm just dragging this forwards. And although it does come forwards, I'm pushing it down as well just to create. If it was going to come out the Rycaret, brilliant. And some of it did. But I now opened the door for the metal. I'm just trying to see where I need to position it. There's an opening there. I want to go over and beyond. So we've got to be careful. We are quite deep, probably 2 centimeters into the ear canal. So the eardrum is just less than a centimeter, or probably even less than that. And I'm just leveraging this out, and you'll see that plug. So it's going to re-enter. There's a bit of skin there at the bottom. We're going to leave that. And you can see that upwards inclination. That's that Cocoon plug. You can see that skin around the periphery, that white, silvery shade. Well, I hope you enjoyed that video, guys. I'm also uploading another video on the Clearwax YouTube channel of the other still image of the wax plug that I uploaded today. Take care, bye.